Treatment of the rheumatoid arthritis. Rheumatoid arthritis is a chronic and general autoimmune disease in which mainly joints are involved. It is one of the complicated and difficult to cure types of diseases commonly seen in clinical situations. Its main manifestations are as follows: symmetrical joint swelling, deformation and stiffness of joints, and subcutaneous nodes. X-ray examination shows typical pathological changes of the joints. Rheumatoid factor can be found in some cases in lab tests. 2 or 3 times as many females suffer rheumatoid arthritis as males. This disease tends to linger for years, attacks the patient time and again, and is highly likely to render the patient deformed. As early as the Neijing times, TCM doctors had already recognized this disease. Traditionally, doctors and medical scholars would classify this disease in the same category as B syndrome, gout, crane knee wind, and severe migratory arthralgia, and give treatments accordingly. This disease is caused by deficiency of vital qi and invasion of pathogenic wind, cold, and damp, which obstruct the vital qi and cause qi and blood stagnation in the meridians. Qi and blood stagnation over a long time forms B syndrome. In the late stage, the spleen, liver, and kidney may also be involved. The accompanying signs and symptoms are deficiency of qi and blood, deficiency of liver and kidney, malnutrition of tendons, bones, meridians, and collaterals, which result in atrophy, spasms of tendons or deformation, dysfunction, stiffness, and dislocation of joints. It is not difficult to make a diagnosis of rheumatoid arthritis. The most current internationally accepted standard for diagnosing this disease is the one revised by the American Institute of Rheumatoid Disease in 1987. It lists 7 conditions. Diagnosis can be made if 4 out of 7 conditions are met. Treatment of this disease can be divided into 3 categories. External treatment, in which acupuncture and Moxibustion are mainly used. Internal therapy, in which oral intake of the medicine is mainly used. And comprehensive therapy, which includes acupuncture and oral medication. Here we will mainly introduce acupuncture treatment methods. Acupuncture treatment. Acupuncture treatment is one of the best therapies for treating rheumatoid arthritis at present. When the disease is in its early stage, the main focus is on expelling the pathogenic factors and relieving the predominant symptoms, while during its middle and late stage, the main emphasis should be on strengthening the body resistance and treating the root cause. However, no matter whether the disease is in its early, middle, or late stages, one should take care to keep the treatment of root and symptoms in proper balance. The general treatment often includes using points on the dumai, back shu points, and points on the kidney and stomach meridians. Local treatment often includes using Asher points and those from the yang meridians of the 4 limbs. The following are several types of B syndrome as well as their related diagnostic theories. Wind, cold, damp type. Manifestations include heaviness, swelling, and severe pain of the joints. The pain is felt like pins and needles or a knife cut. It is aggravated by cold and somewhat relieved with warmth. There is also motor impairment and symmetrical deformation of the joints, which, to different degrees, are shaped like shuttles or bamboo knots. Patients may also have aversion to cold as well as cold hands and feet. The tongue is white with sticky coating. The tongue is slightly enlarged. The pulse is deep, wiry, or tight. Treatment principle: eliminate wind, cold, and damp. Move the qi and relieve pain. Points are mainly selected from the dumai, back shu points, and those from the yang meridians of the 4 limbs. Prescription 1. 大柱 甘舒 筋缩 围中 阴陵泉 足三里 As rheumatoid arthritis is a type of complicated, lingering, and difficult-to-cure disease, two groups of points are used alternately in clinic. Prescription 2. 大椎 膈腧 至阳 肾腧 命门 血海 The above prescriptions of points can be used to strengthen bones and muscles, dredge the meridian pathway to stop pain, eliminate cold and dampness, and promote circulation of qi and blood. The function of the points are 至阳, 肾腧, 命门, 大椎 are mainly used to warm the yang and eliminate cold. 大柱, 甘舒 can be used to promote qi and blood circulation, eliminate wind, remove obstructions from channels, and stop pain. 阴陵泉 and 足三里, which are selected from spleen and stomach meridians, are mainly used to strengthen the spleen and eliminate dampness. Needle with reducing method. For the points on the four limbs, one can needle them deeply and retain the needles for up to 20 or 30 minutes to help the yang qi return. One should manipulate the needles once every 5 to 10 minutes. For some rheumatoid arthritis patients, we can use the Shaoshanhua needling method to warm the yang and expel cold, and to remove stagnation and stop pain. According to Professor Huang's many years of clinical experience with rheumatoid arthritis patients, rheumatoid arthritis cases are usually treated by selecting and puncturing points along the bladder meridian. The above points are for general treatment of rheumatoid arthritis. These two formulas are used alternately. The treatment frequency is about once daily, once every other day, or twice daily for acute cases. Puncture points with reducing method. Local points around the diseased area can be combined with the points of general treatment in clinical practices. When rheumatoid arthritis mainly affects the upper limbs, tianzong, 虚池, 外观, 合谷, should be added in order to promote the qi of the three-arm yang meridians. In the local area, 3 special needling methods, 抱子, 挥子, and 关子, can be added. Around the swelling joints of the tapping needle method can also be used. The above prescription should be used as a basic treatment to which some local points at the particular affected area can be added. When there is pain at the shoulder joint, 肩针, 肩盂, 肩前, 臂闹 can be added. When needling 肩尖 and 肩前, one should pay special attention to the direction of needle insertion. Never needle these 2 points too deeply, lest causing pneumothorax or injury to interior organs. When there is pain in the elbow, add 手三里, 曲子. When these 2 points are needled, one should feel the needle sensation extending to the elbow joint. When there is pain in the wrist, add 阳溪, 阳池, 腕骨. Selecting these 3 points helps to dredge and clear wrist area qi according to the principle of clearing the meridians to stop pain. When there is pain in the fingers, add 八节, 后溪, 'Flexion and extension impairment of the fingers may be treated by needling 四风 with 3-edged needles. If there is pain in the lower limbs, add 治边, 阳陵泉, 三阴交. Yangling-quan is the influential point for sinews which, combined with 治边, helps free the channel qi of the lower limbs. Sanyin-jiao is the point where the 3-leg yin meridians meet. It is important in regulating the qi in the 3 yin meridians. When qi can flow freely, all pain will stop. One should also include additional local points according to the affected parts in the lower limbs. When there is pain in the hip joint, add 承服, 居疗, 缓跳. The sciatic nerve trunk and artery lie under Chengfu, so needle the point with care. In clinical practice, the scraping method is usually applied to increase and expand the needling sensation. When there is pain in the knee, add 内膝炎, 曲拳, 尾阳. When needling these points, one should make sure the needles are strictly sterilized to avoid causing any joint infection. One should also take care to get the ideal posture when inserting the needles. When there is pain in the ankle, add 解析, 太溪, 商丘, 丘虚. It is seldom that rheumatoid arthritis patients complain of pain in the temporomandibular joint. However, should this area be affected, one can add 上关, 下关, 听会. These 3 points are mainly used to course the meridian qi. Pay attention to the direction of insertion while needling 听会. The above-mentioned secondary points can also be applied to local treatment of various types of rheumatoid arthritis. Sometimes acupoints can also be added. Patients with this type of rheumatoid arthritis should avoid exposure to coldness, abstain from cold food, fruit, and food with a bitter taste and cold nature, as such foods can injure the spleen. Wind, damp, heat type. This type of rheumatoid arthritis is commonly seen in the clinic. Its main signs and symptoms are soreness and heaviness of the body and the limbs, and stiffness of the joints. Patients experience limitation of movements of the limbs, especially in the morning. In severe cases, there is intense pain of the joints, redness, swelling, and a burning sensation. There is also symmetric deformity of joints, which become shaped like shuttles or bamboo joints. The tongue is red with yellow and sticky coating, or white, sticky, and dry coating. The pulse is rolling and rapid, or wiry and rapid. The treatment principle: clear heat, eliminate dampness, promote qi circulation, and alleviate pain. Prescription: Da Zhui, Ge Shu, Xue Hai,阴陵泉、足三里、合谷、曲池。Needle with the reducing method once a day. For severe cases, needle twice a day. Meanwhile, the Toutianlang method can be used to clear heat. The prescription has the function of clearing heat, eliminating dampness, dispelling wind, coursing the collaterals, and stopping pain. The above selection of points forms the basic treatment for this type of rheumatoid arthritis. In clinical practice, some local points should also be added. Selection of local points and manipulation are similar to those chosen for wind, cold, damp type. Although the clinical manifestations of rheumatoid arthritis are complex, the disease, no matter what age or whether aggravated by an invasion of external evil, is by nature either wind, cold, damp type or wind, heat, damp type, and should be treated accordingly. In the late stage of the disease, or when not acute, it mainly manifests as deficiency of liver and kidney, or deficiency of both qi and blood. Clinically, we should primarily treat the root. Deficiency of liver and kidney. Clinical manifestation of the deficiency of liver and kidney type: numbness of the body and limbs, swelling and pain of joints, stiffness of the joints in the morning, lassitude of the lower back and knees, tinnitus or deafness, dizziness, irritability or frequent sighing, chills, cold limbs, enlarged tongue with white coating or red tongue with little coating, deep thin pulse or thin fine pulse. Treatment principle: nourish the liver and kidney, promote qi and blood circulation, remove obstruction from Jingluo, and stop pain. Points are mainly chosen from the Renmai, Dumai, liver and kidney meridians, and back shu points. Prescription: Gao Huang, Gan Shu, Ming Men, Shen Shu, Guan Yuan, San Yin Jiao, Tai Xi, Xuan Zhong, Tai Chong. Generally, the points on the back should be needled first. Pay attention to the angle and depth of the needling. Apply tonifying method by lifting, thrusting, and rotating the needles. Gao Huang is mainly used to treat the symptoms of the deficiency type. Guan Yuan and Ming Men warm the yang and eliminate cold, remove obstruction from the channels, and stop pain. San Yin Jiao and Tai Chong promote qi and blood circulation to relieve pain. In addition, Tai Chong is also the yuan source point of the liver meridian and can nourish the liver and reduce liver fire. Xuan Zhong can reinforce the marrow and brain. Treatment is given once a day or once every other day, with 10 times as a course. The above points are the basic part of the protocol. Points may be added or subtracted according to symptoms or the affected parts. For instance, when there is irritability and red tongue with little coating, one can add Xingjian and Laogong to drain fire. Selection of local points are similar to those for wind, cold, damp type. Deficiency of qi in blood. This type is commonly seen in the advanced and final stages. The clinical manifestations are pallor or sallow face, general lassitude, feeble breath, reluctance to speak, shortness of breath with slight exertion, poor appetite, distension in the epigastrium, loose stools, spontaneous sweating, catching cold easily, dizziness, numbness of limbs, swelling and pain of joints, stiffness of the joints in the morning, limitation of movement of joints, pale tongue with little coating or without coating, or peeled tongue. Treatment principle. Invigorate the spleen, regulate and tonify the vital energy in blood, remove obstruction of the channels, and relieve pain. Main points are selected from the spleen, stomach, and Renmai meridians, and back shu points. Prescription. Ge shu, pi shu, wei shu, qi hai, zu san li, yin lin quan. Generally, the points on the back are needled first. Use the tonifying method of lifting, thrusting, and rotating the needles. Zu san li, yin lin quan, pi shu, and wei shu are chosen to strengthen the function of the spleen in order to generate qi in blood. Qi hai is mainly used to warm the yang and promote the qi. Ge shu, which is the influential point for blood, is selected to regulate and promote blood. The above points are the main points. Some local points should also be added according to the location of the rheumatoid arthritis in the same fashion as those for the wind, cold, damp type. In addition, some points should be added according to the specificity of the condition. In case of dizziness, Bai Hui, Tai Chong, Gao Huang are added to calm the liver, reduce the rising yang, extinguish the wind, and stop dizziness. In case of poor appetite and loose stools, Zhongwan, Tianshu are added. The main prescription is chiefly used to strengthen the function of the spleen, reinforce qi in blood, so as to treat the root cause of the disease. The local points are mainly used to remove obstructions from the Jingluo. and to stop pain so as to treat the manifestations. A lot of clinical treatments have proved that acupuncture treatment is one of the best therapies in treating rheumatoid arthritis. In the actual treatment, one should always keep the general and local treatment principles in good balance. The key to successful treatment always lies in the precise and appropriate selection of the points and the correct needling methods. Moxibustion treatment. Moxibustion treatment is usually applied in combination with some other methods, though it is oftentimes used alone. Here we will introduce one particular Moxibustion method, plaster Moxibustion treatment. Treatment time. The hottest period in summer. Point selection. Points along the spine between 大椎 and 腰枢. Materials. 斑氏 powder, 1 to 1.8 grams, or number 3 rheumatoid arthritis powder, 100 grams. Garlic paste, 500 grams. Old moxa wool, 250 grams. Procedure. First, disinfect the area to be treated according to the routine. Then apply 500 grams of garlic juice and 1 to 1.8 grams of bansha powder or number 3 rheumatoid arthritis powder, 100 grams to the area. Prepare a long belt of garlic paste about 2 cuan in width and about 0.5 cuan in thickness above the bansha powder or number 3 rheumatoid arthritis powder. Afterwards, prepare and place a big moxa cone shaped like a long snake on top of the garlic paste. The head, body, and the tail of the long snake are all ignited. Such a treatment is given 2 or 3 times each session. The plaster Moxibustion is characterized by the big cone, powerful fire, and strong warming and penetrating action. In addition, garlic can clear the toxins, dissipate coldness, and reduce swelling. Musk is aromatic and penetrating and is good for removing obstruction of the channels and relieving a palpable mass. Qi of the due meridian can be activated by the constant penetration of powerful Moxibustion, which enables the Qi of the due meridian to reach the interior organs as well as the 4 extremities, and arrive at self-regulation of the body's mechanisms and functions, thus directly dispelling the pathogen and curing the patient of the rheumatoid arthritis. This method can be used for any type of rheumatoid arthritis, but it is especially good for wind, cold, damp type. Post-Moxibustion precautions. Avoid any raw, cold, spicy, greasy food or fish for 1 month after the treatment. The patient should rest. Avoid taking cold showers, exposure to cold and wind, or sexual intercourse. Some patients may experience some side effects such as low fever, weakness of the 4 limbs, lassitude, poor appetite, etc. However, these manifestations are temporary and will gradually and automatically disappear in about 2 weeks. It is unnecessary that they be treated. Treatment of bamboo cupping. This therapy is a combination of both the collaterals bleeding method and the medicinal bamboo jar cupping method. The procedures are as follows. Before cupping, use the tapping needle to tap the skin of the diseased area. The tips of the tapping needle should be quickly withdrawn when it is inserted into the skin. Stimulation can be divided into gentle and heavy types. The heavy one, which causes immediate bleeding after tapping, is suitable for a strong body, severe condition, and some parts where the muscles are thick. While the gentle one, which doesn't cause bleeding until after the bamboo cupping is done, is suitable for patients of weak constitution, mild cases, or those parts where the muscles are very thin. Prepare the herbs for boiling cups as follows: Fangfeng, Mahuang, Chunxiong, Shengdi, Chunjiao, Duzhong. The dosage of each of the herbs is 20 grams. The treatment areas can be divided into 5 regions. Points from the 3 yin meridians of hand in the diseased area are chiefly selected. The diseased area is first tapped with the tapping needle, and then the cups taken out from the boiled medicinal decoction and attached to the tapped skin surface, retained for 15 to 20 minutes. Blood stains are cleaned away by sterilized tissue after the cups are removed. Points from the 3 yang meridians of hand in involved part are mainly selected. One region is chosen bilaterally in each treatment. Needle twice a week with 10 times as a course of treatment. Patients should rest for 2 weeks after being treated for 3 courses. Points from the stomach, gallbladder, and spleen meridian and the affected area are mainly selected. Points from the urinary bladder meridian and the affected area are mainly used. In case of a good constitution, severe condition, or when multiple joints are affected, such treatment can be given 3 times a week. Points from the stomach, spleen, kidney, urinary bladder, and liver meridian and the affected area are chiefly chosen. This therapy is good for treating all types of rheumatoid arthritis. It has the same effects as when acupuncture, cupping, and medicinal steaming methods are used together. In addition to the therapies mentioned above, there are still other therapies such as bee needle treatment, ear acupuncture, and Moxibustion with electric instruments, etc. Those therapies can be used alone or in combination. Here we will introduce a unique and complex therapy called Huang's therapy. Complex treatment. This therapy was developed by Professor Huang Bijun through her decades of clinical treatments of rheumatoid arthritis. She classified rheumatoid arthritis into the active and dormant periods. According to her, the manifestations and branches should be treated mainly during the active period, while the root cause and branch manifestations should be treated side by side during the dormant period. Great importance is attached to the principle of using local and general treatments in coordination. General treatment. Points from the Dumai and Renmai and a number of specific points are used mainly for the basic protocol. Da Zhui, Da Zhu, Ming Men, Zhong Wan, Zhu San Li, Yang Ling Quan. Treatment method. Yang Ling Quan is punctured using the even method, and needles are retained for 20 to 30 minutes. Manipulation is given once every 5 to 10 minutes. Indirect moxibustion with ginger is applied to the other points. 3 moxicones are burned on each point. On top of the basic treatment protocol, Professor Huang also makes additional variations of point combinations according to the actual manifestations of the rheumatoid arthritis in its active and dormant periods. Active period. This refers to an acute attack or acute recurrence of rheumatoid arthritis. Swelling of the joints, pain, and limitation of joint movement are the main manifestations during this period. Rheumatoid arthritis in the active period is further divided into 2 subtypes by Professor Huang. Wind, cold, damp type. Besides the manifestations mentioned above, there is some cold pain in the joints, thin and white tongue with a white slippery coating, and deep, tight, wiry pulse. Treatment. Fengchi, Shenshu are added to the basic protocol. Points are needled with the reinforcing and reducing methods by rapid and slow insertion and withdrawal of the needles. The needles are retained for 10 minutes. Wind, damp, heat type. Besides the manifestations mentioned above, swelling, redness, hot sensation and pain of the joints, red tongue with yellow and greasy coating, slippery and rapid pulse may occur with this type. Treatment method. Qu-chi, Wei-zhong are added to the basic protocol. Points are needled with the reinforcing and reducing methods by rapid and slow insertion and withdrawal of the needles. Or even method. Needles are retained for 30 minutes. Manipulation is given once every 5 to 10 minutes. Static period. The dormant period of rheumatoid arthritis manifests as follows: stable pathogenic condition, lingering disease, deformity occurring in some joints, pain aggravated by movement. It may be further divided into 2 subtypes. Obstruction by pathogenic phlegm and blood stasis. This is manifested as heaviness and swelling of the joints, inconsistent stabbing pain aggravated during the night, purplish tongue with greasy coating, wiry, tense, or deep and slow pulse. Treatment. Pishu, Geshu, Yinlingquan, Xuehai are added on top of the basic protocol. Points are punctured with the reducing method. Needles are retained for 10 minutes. In addition, one can use pricking and cupping of the geshu and pishu. Blood stasis should be drawn out by cupping. Insufficiency type of vital qi. In cases of yang deficiency, the main manifestations are as follows: coldness and pain of the joints, swelling of the extremities and face, cold limbs, pale face, general lassitude, pale tongue with white and slippery coating, and deep, slow pulse. In the case of yin deficiency, there are the following signs and symptoms: restlessness, pain of the joints aggravated during the night, malar flush, red tongue with little coating, thin, wiry, and rapid pulse. Treatment for the yang deficiency type: zhongwan, qihai, and guanyuan may be added on top of the basic protocol. 3 moxicons on top of sliced ginger are applied to each of the points as well. Treatment for yin deficiency type: Danshu, Taixi, Shengshu, and Taichong are added on top of the basic protocol. Points are punctured with the even reinforcing and reducing method. Needles are retained for 10 minutes. Local treatment. Points from the affected area and Asher points are mainly selected. Acupuncture or Moxibustion, assisted by indirect tapping on top of cotton soaked in No. 1 or No. 2 medicinal wine for rheumatoid arthritis, may be applied to the diseased area and the selected points. Tapping is divided into mild, middle, and heavy types. Treatment methods for different types are introduced as follows. In the case of wind, cold, damp type, the cotton soaked with No. 1 medicinal wine for rheumatoid arthritis is spread on the affected area first and followed by tapping the needle. The skin of the affected area should be tapped until flushed, and then Moxibustion with moxicones is applied until the power of Moxibustion penetrates to the deep level of the body. Clinically, some points should be added according to the location of the disorder. In case of rheumatoid arthritis occurring in the upper limbs, Baixie and Wanggu are added. In case of rheumatoid arthritis in the lower limbs, Zhibian is added. 3 moxicones are applied to each of the selected points. In case of wind, heat, damp type of rheumatoid arthritis, cotton soaked in No. 1 medicinal wine for rheumatoid arthritis is spread on the diseased area first, and then followed by tapping and cupping. It is necessary to cause mild bleeding on the skin where it is tapped. Cups are retained for 5 to 10 minutes. In case of phlegm obstruction and blood stasis type or deficiency of vital energy type, Cotton soaked with number 2 medicinal wine for rheumatoid arthritis is spread on the diseased area or selected points, and followed by heavy tapping and indirect moxibustion over garlic paste. It is good for the patient to experience a hot sensation which penetrates to the deep part of the body and renders the skin red. 3 to 5 cones of moxa may be applied. Blistering due to moxibustion should be avoided as much as possible. In case of a few blisters shown on the skin area after moxibustion, treatment is the same as for that for plaster moxibustion. Rheumatoid arthritis is one kind of difficult disease commonly seen in the clinic. However, neither Western medicine nor TCM has found any truly effective medicine or treatment. A lot of clinical practice and research work on treating rheumatoid arthritis have proved that acupuncture as a treatment is one of the best so far. We are likely to find and develop a new and effective way to treat rheumatoid arthritis by furthering our clinical acupuncture practice and research work.
一路漫漫，披荆相伴，